Hello friends, today we will discuss about the disease and their medication. First of all, we will discuss about the cardiovascular drugs. The cardiovascular drugs include the antihypertensive drugs and the hypertensive drugs. The drug which is act on the heart or the cardiovascular system are called as the drug acting on the cardiovascular system. The hypertension is a condition in which the force of the blood against the artery arterioles is very high, is known as the hypertension. And it is also defined as the it is a condition where the blood level is high. Then hypertension, it is defined as the low blood pressure. Then the drug which is used in the hypertension, the drug which is used in the hypertension is known as the antihypertensive drugs. For example of the antihypertensive drugs are the diuretics. Diuretic include the furosemide and the chlorothiazide. Then ACE inhibitor include the captopril and the enalapril. Then angiotensin blockers. It include the telmisartan. Then the direct renin inhibitor that include aliskiren, and beta 1 adrenergic blockers that include the metoprolol, atenolol, and the propranolol. And the last is the calcium channel blocker. The calcium channel blocker include the amlodipine and nifedipine. Then the mechanism of the propranolol. The propranolol is the drug which is used in the treatment of the hypertension. The mechanism of propranolol is it is the selective it selectively block the uh, beta 1 receptor in the heart. It is belonging to category of beta 1 adrenergic blockers. And due to the it's block the beta 1 adrenergic receptor in the heart, it decreases the force of contraction and the heart rate and the cardiac output, and which decreases the BP. Hence, it is used as an antihypertensive drug. Then the diabetes mellitus. The diabetes mellitus is a group of disease characterized by the high level of the blood glucose resulting from the defect in the insulin production or the insulin action or the both. The diabetic mellitus has a two type, that is type 1 and type 2, that is insulin dependent diabetes mellitus and the insulin independent diabetes mellitus. The drug which is used in the treatment of the diabetes, it is known as the anti-diabetic drugs. The classification of anti-diabetic drugs include the sulfonylureas. The sulfonylurea, it includes the first generation sulfonylurea and the second generation sulfonylurea. The first generation sulfonylurea include the tolbutamide and chlorpropamide, and second generation sulfonylurea include the glimepiride and the glipizide. Then the biguanidines include the example of biguanidine is the metformin. Then the alpha glucosidase inhibitor, that is agarbose. Then the mechanism action of the metformin. The drug metformin, it is used in the treatment of the diabetes, so it is called as the anti-diabetic drug. So metformin is the complex drug with the multiple site of the action and multiple molecular mechanism. Physiologically, metformin act directly or the indirectly on the liver to lower the glucose production and act on the gut to increase the glucose uh, utilization and increase the GLP-1 and alter the microbiome. So it is used as an anti-diabetic drug. Then next disease is the uh, acidity. The drug which is used in the treatment of acidity, it is known as the antacid. The antacid is neutralize the stomach acid. The for example of the antacid are the domperidone, omeprazole, then pantoprazole, rabiprazole, etc. Then the mechanism of action of the omeprazole. The omeprazole is the proton pump inhibitor. It is a substituted benzimidazole that belongs to the anti-secretory class of the compound. It inhibit the patient's cell, that is H plus hydrogen potassium ATP pump, and final step of the acid production. In turn, omeprazole suppress gastric basal and the stimulate the acid secretion. The next drug is the pantoprazole. The pantoprazole is also the antacid drug. The mechanism of the pantoprazole is it is a proton pump inhibitor that bind irreversibly or the specifically to the proton pump, and thereby reducing the gastric acid secretion. So it is used as the antacid drug. Then next is a anti-allergic drug. The drug which is used in the treatment of the allergy is known as an anti-allergic drug. For example, cetirizine, levocetirizine. These are the antihistaminic drug. The cetirizine is brand name of the cetirizine is Ocasate, or the brand name of the levocetirizine is the Leocet yum. That is combination of the monticulast plus the levocetirizine. The mechanism of the cetirizine is the cetirizine is and the class of the medication called as the antihistaminics. It is work by blocking the action of histamine and the a substance in the body that causes the allergic symptoms, that is like the sneezing, irritation, etc. Then the fungal or antifungal drugs. The drugs which is used in the treatment of the fungal infection are known as the antifungal drugs. For example, ketoconazole. The ketoconazole is the drug which block the synthesis of ergosterol. It is a key compound of the fungal cell membrane through the inhibition of the cytochrome P450 dependent enzyme lanosterol 14 alpha demethylase, responsible for the conversion of the lanosterol to ergosterol in the fungal cell membrane. The brand name of the ketoconazole like the uh, ketosip or Kesobliss. It is used in the shampoo formulation. It is ketoconazole is used to treat the fungal infection like the dandruff, etc.